My name is Christie Uipi. I am a psychotherapist and the executive director of the Better Mind Center. We are a group of therapists who specialize in the treatment of chronic pain and chronic symptoms. And today we are going to be talking about somatic tracking, which is a cornerstone technique in pain reprocessing therapy, also known as PRT. Somatic tracking is a form of mindfulness meditation in which you are focusing on the fear-inducing stimulus while practicing specific fear reduction strategies. So what does this mean? It means you're focusing on the sensation of your pain or the sensation of your symptom while trying to downregulate your nervous system. The goal here is to help you attend to the pain or the symptom through a lens of safety. It's not easy to do. We humans are wired to feel pain and have an activating response, to feel afraid, nervous, or avoidant. So somatic tracking is helping us work against that natural wiring and, again, down-regulate the nervous system. It's essentially helping you process the pain experience as something that is safe or safer than that automatic response of fear is telling you that it is. There are three components of somatic tracking. The first one, mindfulness. Mindfulness is a broad category and concept. Mindfulness, as it is applied to meditation, generally speaking, means attending to something, a sensation, in the present moment, moment to moment, non-judgmentally. So when you're practicing mindfulness meditation in general, not talking about somatic tracking, usually you're focusing on the sensation of your breath in a present moment type of a way. Whatever the breath feels like, it feels like you're allowing it to be without forcing or changing it. I hear all the time that prior to entering the world of mind-body medicine, prior to practicing somatic tracking, folks with neuroplastic pain or mind-body symptoms tell me mindfulness did not make me feel better. Mindfulness made me feel worse. I spend all day trying to avoid and ignore my pain sensations in my body, and then mindfulness forces me to pay full attention to my body. It's impossible. It stresses me out. If that has been your experience, that's really typical. Not everyone feels that way, but it is a typical response. And these next two components of somatic tracking is what helps distinguish it from general mindfulness. And often these are the two components that help someone practice downregulating their nervous system. The second component is called safety reappraisal. That's where that active scripting comes in, helping a person, the chronic pain sufferer, actively appraise the pain sensation as something that is non-dangerous to them. This, again, is for folks who are understanding their pain to be neuroplastic in nature, or at least partially neuroplastic in nature, helping you program the pain experience as something that is safe, non-harmful, and not indicative of threat, injury, or illness. The third component of somatic tracking is called positive affect induction, which is basically a fancy way of just saying we want to keep the mood light. We want to introduce an atmosphere that is non-threatening. I have found that this can be pretty tricky to do on your own, which is one of the reasons why I want to practice here together, so that you feel hopefully a little bit better equipped to practice that when you are leading yourself through a somatic tracking experience. So we're going to begin our somatic tracking practice. It's going to take about 5 minutes. And if you're practicing along with me, I want to ask you to close your eyes. And I want to give you this first minute to settle into your internal world, settle into the sensation of your breathing, using the sensation of your breath as an invitation into stillness and into calm. Letting this first minute go by slowly. Focusing only on the sensation of your breath, knowing that it's perfectly normal and okay if your mind wanders and leaves the sensation of your breath. It just means your brain is alive and working. Anytime that happens, I invite you to return to the sensation of your breathing, settle in and settle down again. Just familiarizing yourself with the sensation of your breathing. And now that you've settled into the sensation of your breathing for a minute or so, you know this is home base. We'll return to home base in a few minutes. I'd like to ask you to shift your attention or awareness. Shift your attention or awareness to the area of your body where you are feeling pain or unpleasant sensation. I want you to shift into it without changing your energy or intention. We're still just noticing the sensation the same way we noticed the sensation of your breath. And we'll spend a couple minutes here together noticing the sensation of your pain without trying to change it or shift it, without trying to make it be anything that it is or it isn't. Just noticing the sensation of pain, the same way that you notice clouds passing by in the sky. If there are shifts, let it shift. If it's a boring, cloudy day and the sensation is just lingering and staying, just linger and stay with it. It's okay. I want us to notice the sensation of pain in a way that is no different from how we notice the sensation of your breath. The sensation of pain is what it is, it's doing what it's doing. And you and I are just exploring it together. Like I have a flashlight or you have a flashlight. We're shining a flashlight on that area of your body and saying, what's here right now? And if the sensation stays, stay with it. And if it shifts, shift your attention with it. If it intensifies, hang in. You're safe. If it softens, let it soften. It's just you and me exploring this sensation together, letting it be what it is, the same way the clouds roll through the sky and move how they move and shift how they shift or stay how they stay. Now that we've explored that sensation for a couple of minutes together, I'm going to ask you with your eyes still closed to return to the sensation of your breath. Come back to home base, feeling the sensations of your inhales and your exhales again. And we'll spend one more minute here in home base, noticing how your breath feels now. Noticing if anything has shifted about the quality of your breath, the deepness, the shallowness since we started this exercise, and allowing any and all of those things to be fine. Just checking in with the sensation of your breath, coming back into your breathing, back into a part of your body that may feel neutral or inviting. And then, whenever you're ready, you can open your eyes back up.